able to get any numbers from the parole board, how many expedited reviews have been conducted and how many people have been released per that process to date?
Yes, the question is about paroles and numbers that are on parole, and I'm going to let Secretary Moran address that. Secretary of Public Safety.
Thank you, Governor. Yes, with respect to the parole and the direction that the governor has provided the parole board, and again, this is something the governor has directed the parole board from day one of his administration, is to review these with great diligence and providing individuals with second chances. So that has been going on throughout this administration. With the onset of this crisis, we have reiterated that direction, and they are doing a great deal with respect to review. There are a number of challenges because by the code, we have no parole in the Commonwealth of Virginia. It is limited to geriatric release and limited to those who were sentenced before 1996. So you have a limited population by which can even be reviewed. Additionally, by Constitution, the victims need to be notified, and you have to provide victims time to weigh in on their decision. And that is an ongoing process as well. And we've heard from a lot of victims. Every time questions are asked or reports are written with respect to releasing people, you're generating a lot of interest from a lot of individuals. And so I can tell you 2 steps have already been taken. That is good news. The parole board has withdrawn warrants on technical violations for a number of individuals. What that will do is not introduce those into the criminal justice system. We're waiving the warrants so they don't have to get arrested. They don't have to go to the local court for a hearing. Secondly, they have expedited release of parole for those who are already been released. So what that does is eliminate interaction between the parole supervisor and the individual. And so, again, both of those efforts and decisions have eliminated additional interaction, which, of course, is what we're ultimately trying to do with self-distancing. So the expeditious review is ongoing with that limited population by which is even available to us for early release. And I will say, I know a lot of concern is among many advocacy groups, and we all share that concern. And I can tell you I'm just so proud of Harold Clark at the Department of Corrections, what he has been doing to ensure the safety of his correctional staff, but then also of the residents at our over 41 facilities. Extraordinary steps are been taken. We've essentially locked down the prisons to outsiders, which could introduce the virus into a contained setting. So parole board has their direction. They're working overtime. And again, our Department of Corrections is doing everything they can to prevent the introduction of this disease.
Are there any specific numbers, though, that would sort of give us a sense of what kind of is happening?
Well, the specific numbers are those that are even eligible for it, right? So that is a limited basis. And then you have to determine whether or not there is a home health plan for those individuals. And so we're looking at those who are closest to release. So I'd be happy to give you numbers, and I'll get those numbers. We're not, I'd be happy to share specifically if you want how many inmates, but it's a matter of trying to determine the eligibility, Ned, that is somewhat, it's difficult, but again, they're working 24/7 to accomplish it, and we're going to do everything we can, but we're not going to release somebody unless they have a home health plan. It'd be inhumane to them, and frankly, they're getting a lot of health care in these facilities. I mean, we are doing our very best not to have the virus introduced, and they're currently receiving care. Everyone who's coming in is getting a temperature taken, the forehead temperature device, and so again, we're doing everything we can not to allow that virus in the first place to be introduced. And thanks.
Thank you all again for listening and watching today. The message today, as I said, is very clear. Stay home. We know that social distancing, we know that frequent hand washing will help minimize the spread of this virus. You have heard us talk every day about flattening that curve. As you go through your day-to-day activities and make decisions, what's essential and what's not essential, think of those healthcare providers, watch those pictures, what these individuals are going through every day to take care of our sick folks across this country. And I ask you just to do the right thing. Thank you all.